What makes us healthy or causes us to struggle with illness and mental health issues can often be beyond our control. Our health and well-being are deeply influenced by the amount of stress in the environment we grow up in. That's why identifying adverse childhood experiences by taking the screening survey can be helpful for everyone, regardless of age. But what exactly are adverse childhood experiences, and how can they contribute to toxic stress? We can think about this as the absence of some things and the presence of others. Consider, is your home a predictable, stable place? Is there physical or emotional violence in your home? Is your neighborhood safe? Is healthy food easily accessible for you? Are you connected with neighbors or other community members whom you trust? Adverse childhood experiences are also known as ACEs. With each ACE a child goes through, the higher the likelihood that stress can become toxic. Toxic stress can cause children to struggle in school and increase the risk of health issues like heart disease, diabetes, or even substance abuse later on in life. The good news is once you know if there are any adverse experiences in your child's life, Eisner Health can provide resources to help you and your child cope with them now and reduce possible negative outcomes or potential health issues later in life. So, how do you know if you or your child has any ACEs? You take the ACEs survey. Understanding how stress can become toxic and how adverse childhood experiences can impact us later in life helps us examine our current physical and mental health, which can open doors to improvement not only for ourselves but future generations. There are 10 widely recognized ACEs that your provider might ask you about: physical abuse, emotional abuse, verbal abuse, sexual abuse, emotional neglect, physical neglect. Growing up in a household where there are adults with substance or alcohol abuse problems. There are adults with mental health problems. There is violence in the home or neighborhood. There are adults who have spent time in prison. Parents have separated. While ACEs can create toxic levels of stress, which can have long-lasting effects on health, behaviors, and life potential, they are not destiny. Once we identify and understand any ACEs in a child's life, then we can work together to find ways to decrease ACEs from a child's life and heal. To heal requires developing resilience, which is the ability to bounce back from life's difficulties. Like a muscle, the more you exercise resilience, the stronger it grows. Resilience can be developed by maintaining meaningful relationships, building self-confidence, setting goals, practicing mindfulness, getting mental health support, engaging in physical activity or exercise. Now that you know what ACEs are, the next step is understanding what, if any, stressors are impacting your child's life. As a patient of Eisner Health, children and young adults have the opportunity to take the ACEs screening and be connected to the help you and your child may need. These screenings typically take place during your annual doctor's visits. Together, we can understand the impact of toxic stress and support those who've been through ACEs, building a healthier, happier future for all. If you would like to learn more about ACEs and how they might be impacting you or your child's health, call us at 213-747-5542 to set up an appointment with our case management team.